We're going to talk about empowerment. So, this is chapter 3 of Kelly Turner's Radical Hope book. Kelly Turner has given us 10 pathways to disease remission. She's a PhD in oncology counseling. She traveled the world for her dissertation to find out how people put advanced cancer into remission. And I am pulling her citations and learning so much and so excited to bring these findings to you. We're all in the business of putting disease into remission, even before it starts, preventing disease, so that we can lead an incredible life. And she makes beautiful arguments for why empowerment goes on the list of how you put disease into remission. Now, I love starting out with some of her quotes. She's an excellent writer, she's an excellent thinker, and the way she puts things really helps me understand why we do what we do. I have to tell you that since reading her first book, Radical Remission, and now really diving into Radical Hope and watching her docuseries. Episode 1 of Radical Remission docuseries is at YouTube. I can't recommend it enough. Here's a quote. Doctors are experts, but they're not experts in you. Only you can be the expert in you. And this ties in very closely to a chapter later in this series on intuition. And you hear our hosts all the time saying, wait until your intuition tells you that you're ready to do whatever the next step is. So we're very, very keen here in the ARC about teaching you how to find out about yourself, self-awareness. This is another great quote. She's just calling it like it is. It's easy to forget that doctors don't yet have all the answers, especially when it comes to chronic conditions like cancer, Lyme disease, Alzheimer's, and multiple sclerosis. And I have found this to be true. Thanks to Kelly Turner's book, I have expanded my team of practitioners. I now have a practitioner who is a doctor of Chinese medicine, naturopath, and acupuncture. And I've added a therapist, a talk therapist, to my team because I am determined to put my asthma into remission, and it's working. I've also added a once-a-week massage so that I get my body really relaxed. It's all working. My asthma is getting better every day. This is another great, great quote. This really put the whole idea of empowerment and skill building into context. Why do we need these skills? Radical remission thrivers require multiple healing strategies. Multiple healing strategies. I need herbs for my asthma. I need acupuncture. I need talk therapy. I need qigong. I need a lot. Multiple healing strategies. It wasn't until I got this idea from Dr. Turner that I needed to pile on healing strategies if I was going to get my lifelong asthma to go into remission. Then I said, oh, okay, so I have to do this and that and that and this other thing and this other thing. No one thing. And it's not like I'm going to try something. Oh, I don't think it works. And then abandon it. No, I'm going to keep adding. The way she puts this is so sensible. In order to research and implement healing strategies, thrivers need to be empowered when it comes to their health. There's stuff we've got to be able to do. Take an active role in our health, not a passive role. Don't just sit back and do whatever it is you're told. You have to have the willingness to sometimes make drastic changes in our lives. And this takes skills. It takes a sense of being powerful, I am powerful in my life. I easily make changes in my life. And this is something that I really hadn't considered, although I'm experiencing it myself. I have a medical doctor in my close family, and I get the pushback, and that's not how asthma works. The ability to deal with resistance from friends, family, and medical staff, where your intuition is telling you what to do and you have a clear path, and the people around you are afraid or angry because they want you to do something different. So this is why we have to feel powerful if we're going to be healthy. She just lays that out beautifully. Well, what does the science tell us? So she's got great citations in her book, and I was able to develop the science easily. Skill building versus support. So this is a study where two groups after breast cancer, one got just support and the other one got skill building. They got health education. They got enhancement of problem solving skills. They got stress management skills, and they got psychological support. So what happened? The skill builders exhibited more positive attitudes 2 and 6 months after treatment, less helplessness and hopelessness at 2 months. This is what having skills does for you. You feel powerful. Your pain is going to be less. You're going to be able to manage pain more easily. Of course, when you look at it this way, it's just so sensible. And duh, if you have a lot of skills, you're going to feel more positive, less helpless, and less hopeless. This was another study of coping skills. So people with a diagnosis of breast cancer were asked about their coping skills. And then their quality of life was evaluated some months later. So one group had positive coping skills. They were planning. They were problem solving. They were positively reframing their situation. And they accepted that they needed to do things about it. The negative coping skills were self-blame, denial of the condition, and really withdrawing. Instead of engaging and doing research and talking to people and getting second opinions, they disengaged, behavioral disengagement. They tried to avoid the situation, cognitive escape avoidance. They tried to just not think about it at all. They suppressed the emotions that they felt about it, and they kept to themselves. These are negative coping skills. Now let's see what happened. The people with the positive skills had decreased depression and increased positive mood. Now, if you're going through a crisis in life, if you can stay positive, you can stay creative. If you go into depression, that kind of depresses problem solving too. The people who were using negative coping skills had a greater fear of recurrence, more anger, and more depression. This is just, I think this is stunning. That skills, being aware of your skills, and we're going to go through all the skills that the ARC teaches as part of this presentation. And what I really hope is by the end of this presentation, you will have decreased depression, increased positive mood, because you will be fully aware of the skills that you're getting in the ARC. This is so interesting. Higher survival after cancer is preceded by higher optimism, higher expectation kind of the impact, less expectation, more minimization of the impact so that you're free to move forward, and lower helplessness, hopelessness before the disease progressed. So this is very, very telling. It's very indicative of how you're going to come out of a disease. Your attitude is a big, big factor in it. There's another study from White, 2017, perceived self-efficacy. What is self-efficacy? It's I can do it. That's all that means. It's a fancy term for I am effective and I perceive myself to be effective. So perceived self-efficacy, self-effectiveness, if you will, leads to better quality of life, functional status. Functional meaning you are doing more things. Symptom distress and healthcare use. So you're more intelligent and more effective in the way you use healthcare services. And your symptoms are reduced, less pain. Super. It's just so cool how our thoughts can affect our physical and our life well-being. Now, the people who had greater perceived self-efficacy, particularly of symptom management, they also had improved performance outcomes. Their health status was improved, their cognitive function was improved, and their disease status was improved. This has a direct impact on how we recover from disease. So this is, just get ready. This is going to be, I think, really amazing. The extensive skill building that you get in the ARC, it's not something that people are aware of because it's just happening. Whenever you listen to two ARC members talking to each other, they are talking about things they're doing, and they're doing those things because they have the skill to do them. So we're not always aware when we're getting skills, but skill number one is recover and prevent medical conditions. I have been sick my whole life. I've had asthma my whole life. I've had migraines since I was a young adult. I've had fatigue. I've had a lot of different illnesses. I've had seizures. And I am now leading a healthy life in a very, very healthy body. And it takes some getting used to. But I've had to get the right practitioners and learn my own method of weight management. Because as you know, in the ARC, we train people in how to create, explore, experiment, gather data on what foods work for them, and then put together their own food plan. I have to feel safe in my body. I have to be okay being super 100% healthy in a culture where 88% of Americans have either high cholesterol, triglycerides, glucose, or blood pressure, or weight. 88% of Americans are now. I have to be okay being very, very different from the people around me. Gratitude, oh my gosh, the list just goes on. Accept that processed foods are severely addictive. And again, this is a skill set. No, I really, really don't want to eat that. I don't want to have cravings for 4 days. I don't want to be closer to lapsing than I am right now. And this is a process. It's a skill set to be able to look around you, see people who are severely addicted, and be okay not being addicted with them. Stress management. Oh my gosh. We live in a culture which profits from stressing us out. There's so many different ways that these corporations have learned to stress us out. You're not good enough. You need to buy our product. You're unhappy. You need to buy our product. You've watched a horrific entertainment program, and now you're scared to buy our product to feel better. Defend against industry that profits. Look at this list: media, food, fashion, glamour, medical, pharmaceuticals, diet industries. They all profit from the consequences of processed foods. And a skill set to defend against them, to recognize their messaging, to avoid their messaging, to recognize when they're just lying through their teeth and see the truth of it. You know, call the emperor has no clothes. And these are all skills that you gain. And of course, you know, the ARC has a huge library. A lot of these skills are being taught in the library. Defend against social cueing. Now, this is a very complex set of skills because people all around us are pushing these foods. They're eating them. They're triggering us. how can we live in a culture, be happy in the culture, secure in the culture, when everybody around us is using? This is a skill set. Manage food cues, because when people aren't actively using in front of us, they're leaving it around. Our workplaces are full of it. Our homes are full of it. Our roadways are full of it. And when you have that skill set of being able to know when you've been triggered, it's not you, it's addicted brain cells. And that dopamine load, the serotonin load, the opioid load, and the cannabinoid load are building up in your brain. And what do you do? How do you calm down? How do you pull yourself out of that? How do you walk over to a different part of your brain? That's a huge skill set. Safely navigate different spaces and events. All of these places, you're going in and out of heavily triggered. I mean, I think grocery stores have just, you're inundated with triggers as soon as you walk in. Safely navigating those, preparing, writing a play. I have to go to the grocery store. This is how I want it to come out. Emailing people beforehand, taking your own food. These are all skills that we develop in the ARC. Maintain a vigorous frontal lobe. We've got to stay on our toes. We can't afford to have the blood supply going back into our addicted and stress pathways. We have to keep that blood supply right in the frontal lobe. And then build memory, restore our cognitive functions that were impaired because we were given this horrible, deep addiction. So this is, you're not going to see this skill set on very many programs, but we know it's essential. You've got to be able to think through circumstances all the time. Prevent and rebound from a relapse. So many programs have taught you to go into a shame spiral if you relapse. There's something wrong with you. We are teaching how to stay powerful right through a relapse. Cueing is everywhere. It's very powerful. Our brains are very sensitive. Our brains react to it very, very easily. And sometimes those craving neurotransmitters just build up in our brain and we have a lapse. We need a skill set for coming right out of that. And of course we do. We have that skill set. We have the 5 steps to rebound from a relapse video. Clean meal production and clean meals that work for you. Not a clean meals that follows somebody else's fantasy food plan. You've done the research. We have the food rotation videos where you can learn easily. It's actually easier to do. This is not a classic rotation that you might be thinking of, but these are rotation videos that lay out how to lay out your food plan so that you can learn what foods really work for you. This is a huge, to eat differently from your culture for the rest of your life, it requires a huge skill set. Care for ourselves physically. This is a skill set which most people just don't have. We're being mesmerized, hypnotized by screens, and we don't move around enough because we've been addicted to those screens. This is not our fault. But the whole idea of how much exercise and what kind of exercise and what kind of movement does my body need? How do I feel after Qigong versus after some aerobic exercise? How do I feel after a walk, if I'm just walking around my living room versus actually going outside and walking? What works for me? Care for ourselves mentally. This is a skill set where you are learning to protect your brain. Your brain will helplessly pull in messaging. So you learn to protect your brain from messaging, from toxic messaging. You don't want other people's toxic thoughts or toxic advertising or toxic news, toxic media. You don't want that in your brain cells. Learning how to block that out, you can use ARC. You need some entertainment, turn on an ARC screen, you will be entertained for sure. Or if there's nothing live going on the ARC screen, get out an ARC video from the library at foodaddictionreset.com. Just protecting your brain is a huge skill set. Knowing what it needs and knowing how to feed your brain positive messaging, it's a skill set. I will say this is one that the ARC makes very easy. The programming in the ARC is very, very reliable. All the hosts are highly trained in positivity, and you will always be getting safe, healthy, nourishing messaging from the ARC. Care for ourselves emotionally. We've been devastated emotionally. We've been gaslighted. We've been traumatized. We've been lied to. We've had substances in our bodies that run our emotions. So in disengaging from that and learning your own emotional control, learning all the many, many different ways that you can release dopamine in your brain in a nice, safe, stable way. You can release serotonin, you can release opioids, and you can release the cannabinoids. You can release oxytocin in your brain. These are all neurotransmitters and hormones that create mood, that create emotions. And just like a chemical engineer knows how to run chemicals through a refinery, you learn how to run your own chemicals through your own brain, and you stop letting other people and advertisers control the emotion neurotransmitters, the emotion hormones in your body. And this is a skill set, recover from a severe addiction. Learn how to live without cravings. Learn how to be self-determining. I control what I do. I don't let substances do that. I don't let messaging do that. I am in control. I hang around with people who are in control. My mirror neurons, my urge to belong are totally safe belonging in this group. But it's a skill set. Living in this world without being part of the sick culture. When you have 88% of people with a disturbed metabolism, we live in a sick culture. It's sick mentally, it's sick emotionally, it's sick physically. But nonetheless, we live here. This is our culture. We love these people. It's a skill set to filter all the ways that you could be connected to that world and pick the connection points that are going to nourish you. It's a skill set. How to use the ARC. This is a skill set. How to figure out which part of the Zoom programming you're going to listen to or watch or talk through. How to find your emails, listen to the podcast daily. How to engage with your advocate and your home pods. How to engage in the specialty pods. These are routines that you build up, but you are evaluating what parts of the ARC work best for me. Do I really like the writing pod best and I just want to hang out in there all the time? Or do I really want to go to intention hour and check in? Or is it writing hour? What works for me? And this is the last one, but it's the most important one probably, which is parenting, taking care of children and being parented ourselves. I know I'm being parented for the first time. All these skills are skills that I should have picked up from my parents, but they were so incapable themselves. They just could never have possibly given me all these skills. But when you do it in a group, it impacts you much more greatly. It normalizes it. This is a key word I should have been using a lot. The normalization of these healthy behaviors, the normalization of having an extraordinary life. You can feel that normalization, which means you can hang on to it for a lifetime. If you're around people who are doing it, then it feels normal and you keep doing it. Oh, everybody's doing it. I'm doing it too. And then we will have the Remission optimistic community, where if you are working on a diagnosis that you've been told is incurable, it's a separate program, but it uses the ARC resources. Okay, now this is a great quote from Kelly Turner. I think it sums up exactly what she's talking about. Doctors inadvertently increase fear from diagnoses by rushing the patients into quick decisions regarding their medical treatment. But remission thrivers feel this panic and pressure to make quick decisions. And they also feel, however, empowered enough to ask their doctors for some time to think, even if it's only for a few days. I just had this happen to me. I got diagnosed with cataracts. And the professional there is just pressuring. You got to make this appointment right away to get the surgery. And here's the clinic. And give me your phone because I'm going to load this information into your phone. And when are you going to make the appointment? Are you going to call them right now? Do you want me to call them right now? No, 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 and no. I was pretty sure that my acupuncturist would have an opinion about getting this cleared up. And sure enough, he did. And he said, we can work on it here in the acupuncture. So yeah, you are empowered to say no to a medical professional. Thrivers use this critical window of time to seek out second or third medical opinions, begin researching complementary and alternative therapies, make sure they feel fully informed when it comes to deciding their first steps of treatment. So I love this phrase, trust the diagnosis, but not the prognosis. So as we know, and we love these doctors, it's not their fault, but they're trained in very specific things, surgery, pharmacology, and sometimes a few other things. There's a whole world of healthcare out there beyond those options. And it's just so critical to know that doctors are working within a framework. And if they say go home and you get your affairs in order, I don't think you're going to see the end of the year. Don't trust that, because they have very narrow things that they can do. Okay, here's one resource from this chapter, the empowerment chapter that I wanted to share with you, Jane McClellan, How to Starve Cancer book. That doesn't mean it would work for any other disease, but I do trust Kelly Turner, and she is listing this as a resource. So here are your do's. Do recognize the limiting belief. If you have a belief in your head, I can't do that, that's a limiting belief. Process your negative emotions in your ARC check-ins or with your advocate. Speak your strong intentions about what your intuition is telling you. Speak it out loud, make it clear, and then you can act on it. And set boundaries with opposing opinions. You know what's best for you. Don't be pulled off your intuition. Don't second guess yourself. You're the expert in you. And do ask lots of questions. You can ask questions of us at info@processedfoodaddiction.com. That's our main website, processedfoodaddiction.com. If you want to join the Remission Optimistic community, remissionoptimistic.com is the website for that. Join us for training. Oh my gosh, the training is magical. You can learn more there at foodaddictionrecoveryadvocate.com. I am just so glad you came here today. I hope you are all pumped up. I hope you especially get this message, which is if you've been in programs which did not teach these comprehensive skills, then the program not working is not your fault. We need every one of these skills, and we need an easy environment in which to learn them. I just read some research recently showing that people absorb best when they're listening to a conversation. So a lot of the ARC programming is a conversation full of science, full of understanding, full of ideas, full of action steps. And people are surprised when they really sit back and think about all the skills they have developed just from listening to these conversations. So enjoy. It's a great process. It's easy to do in the arc, and you are empowered. Take care, everybody.